Welcome to the first EPOCH Practice webinar on US homelessness data and what Europe can learn in comparison. Thank you all for being here. And we will hear from Dr. Culhane shortly, who very kindly joins us today. And also Freek beside me will have a dialogue with Dr. Culhane later on, and then we'll be followed by a Q&A. So please feel free to put any of your questions throughout the webinar into the Q&A box, which is just located beside the chat box. We also have some colleagues monitoring the chat, so if anything comes up for you, if you have technical issues, just drop it in there and let us know. So maybe a bit of background about EPOCH Practice, because this is our first public event. So EPOCH Practice is the next phase of mutual learning for the European Platform on Combating Homelessness. It's co-funded by the European Commission and delivered by FEANTSA. And the program of activities will involve study visits, trainings, good practice publications, a community of practice, and this webinar is the first in a series of 12. So we have a lot upcoming. We have a lot more content for you all, hopefully to see many of you at those events. So to keep in touch, if you want to subscribe to our bulletin, which will be in the chat box, the link, you'll also see a QR code at the end of the meeting. And similarly, our social media as well. We're on LinkedIn and we're on X at the moment. So you can keep up to date with everything that's happening there. And yeah, okay, I think that summarizes it, but certainly feel free to get in touch if you have any questions about EPOCH Practice, and we're always very glad to hear from you. And then let me tell you about Dr. Culhane, who's going to speak to us first about his research on US homelessness. Dr. Culhane is a professor of social science at the University of Pennsylvania with a research focus on homelessness and housing policy. His work has contributed to efforts to address the housing and support needs of people experiencing housing emergencies and long-term homelessness. Most recently, he's focused on using linked administrative data to gain a better understanding of the service utilization patterns of vulnerable populations. He co-directs Actionable Intelligence for Social Policy, an initiative promoting integrated data systems by states and localities for policy analysis and system reform. He's co-authored multiple annual homelessness assessment reports to Congress on behalf of the Department of Housing and published widely on US homelessness policies. So thanks, Dennis, for being here with us today and making the time, and I will hand the floor over to you.
Thank you, Sylvia, and thank you, Freek. It's a pleasure to be here. I think that it's ambitious to suggest that I might be informing European conversations, because these data still need to inform, I think, of a wider understanding in the United States. But hopefully through this presentation, I'll be able to share, let me see if I can move to sharing the slides. I'll be able to explain just some general trends and talk about how those trends reflect different federal policy impacts, continuing systemic shortfalls in U.S. policy, and some of the emerging trends that we're facing. So I want to first acknowledge some of the folks who are involved in collecting all of this data. This annual homelessness assessment report, which started in 2007 in the U.S., is a huge undertaking. It's coordinated by staff at Apt Associates and led by Megan Henry and Jill Kaduri. They are working as contractors to the U.S. Department of Housing and Development. William Snow and his staff are the folks who are responsible for overseeing the overall project and getting it delivered. But even more importantly, the wider group of folks involved are the data collectors. We have in local continuums of care. There are data management leads who maintain these data. There are staff, coordinated entry staff, who do the intake interviews with clients and other data collection activities with clients. And of course, the clients themselves are making available this data. So this is a big effort that requires a lot of resources and time in the United States. And I suppose a lesson for other places, this is well worth it. I hope that the presentation today will help to say that these data can be put to valuable use to help guide our policy and planning in this respective area. So I first want to start out by talking about the predominant narratives that we hear in the US media about homelessness. There's the unsheltered crisis on the West Coast and beyond. This is, been quite disturbing in terms of the rate of growth since about 2014, and is causing quite a bit of consternation. The general public is concerned. Of course, there's these hundreds of thousands of unsheltered people who are affected. So it's a very significant social issue at the time. It has led to a dilemma about what to do with encampments that have emerged, where people are joining together in groups, occupying parks and perhaps other public spaces, which has led to a criminalization movement where different local governments, there's even a pending Supreme Court case in the United States where they will hear whether or not local governments can make camping in certain areas illegal and people subject to arrest. At a policy level, there have been attacks on the Housing First policy that has been adopted in the US. And more recently, in the last year and a half, there's been the impact of the border crisis with migrants who are crossing and who are being sent systematically to different US cities, and has created a unexpected and significant burden in some local homeless service programs. So I also want to note, I think we have a couple sort of forgotten narratives, perhaps even ignored. One is that we have had pretty significant success in federal homeless programs that seems to be largely unknown to the general public. And also, I don't feel we are really focusing on the failures in the federal safety net that are underlying this. And this will all, I hope, fit together in the presentation I do here this morning. So first, just to provide an illustration of the unsheltered homelessness crisis in the US, you can see from this map, if you're familiar with geography of the US, the West Coast is the place that has been most impacted by the unsheltered homeless crisis in magnitudes of tenfold relative to, let's say, for example, the Northeast and Midwest, which is this large area here. We also see that the southeastern part of the US is also more impacted than the Northeast and Midwest, but not as much as we see on the West Coast, okay? We have a mixture of things going on here in the mountain region. These are relatively lower populated states, but generally there's certainly less unsheltered homelessness and encampments in those areas. So just to give you an overview of what's happened in the trends in the point in time counts. These are the counts that occur on one day in the US, and it's a very imperfect number. It's an underestimate of homelessness. It's widely understood because, particularly with regard to unsheltered people, we are only really counting people who are visible or invisible locations. So there are certainly people who are undercounted in these numbers, but it's interesting that here, combining these across, we are able to discern some trends. Most importantly here, I just want to point out, we had a drop from 2007 to 2016. We had about a 100,000 person decline in these homeless counts over that period of time. And we had two phenomena sort of going on. We have the continuing impact of the Bush administration's chronic homeless initiative. And then we also have a number of things that happened since 2009, which I'm going to talk about, which had a big impact. Since then, you could see that basically from 2016 to 2018, it was flat. Then we saw 2% increases in the subsequent few years, and then another flat observation. I will talk about what happened in 2023 at the end of the presentation, but I don't want it to obscure this part of the conversation where I want to focus on these trends. So, about a 15% decline, and then relatively flat with a couple percent increases. Now, what's really interesting about that is the idea that homelessness was not increasing very much in the United States in this period post-2016, even though we know there's been widespread growth of unsheltered homelessness on the West Coast. So clearly that there's something else going on, because the numbers would not stay flat unless the homeless were actually going down in the rest of the country. So I want to get to that in a minute, but here first you can see the impact of the chronic homeless population in the growth in the chronic homeless population since 2016. Okay, we have almost would be about a 50% increase, even more, 65% increase in chronic homelessness since 2016, which is a big reversal from the trend we were going on. We had the Chronic Homeless Initiative, as I mentioned, then we had the Veteran Homeless Initiative, which included a focus on chronic homelessness. And so we had a substantial decline here, but that has clearly been reversed. I also want to note, however, and this me.
I think we lost Dennis, unfortunately. Dennis, you were gone for 30 seconds.
So much for live TV. I hope I'm back.
Yeah, you're back. You're back. No worries. It was 30 seconds only.
All right, very good. So, but what else you can see here? The green line here with the circles is the non-chronic homeless population that's unsheltered. So not only was the increase on the West Coast occurring among the chronic homeless population, but you can also see an almost doubling in the population that's not chronically homeless. And this is just the largest cities. It's not all cities in the US, but does reflect a big trend. So what are some of the primary causes of this? We did have one study that was undertaken specifically in this period and in the late 20-teens that looked at changes in housing affordability and the poverty rate. So you have housing affordability here, which is the rent to income ratio. Then you have the poverty rate of the cities. And then here's your projected homelessness rate based on that. And it's kind of in this three-dimensional space. And what emerges is there's a group of cities in this corner here where you have very substantial high rates. Almost 1% of the population is homeless at a given point in time, up to 0.8. And there's really 8 communities that are most reflected here. These would be Seattle and Portland, the Bay Area, San Francisco, Los Angeles, and San Diego, as well as Denver, New York, and DC. Those 8 cities together account for the vast majority of the increases that we've seen in unsheltered homelessness and chronic homelessness. And here's a map that reflects that. The red areas are the areas where the growth has been greatest. Oregon and Colorado have large continuums of care, which means that the whole state sort of is reflected in this, even if the concentration is really in the largest cities. We do see, of course, a few communities in Florida as well. You can't see the New York and DC because they're too small on the map, but in the report, when we blow it up, you can see that those areas also show up. So a question I know that's been nagging people is, why do we have higher unsheltered homelessness rates in these areas, even when in many communities, the rates are not different than they are in other parts of the US. Same rates of homelessness, but vast differences. I just give you New York as the big example. New York has about a 5% unsheltered homelessness rate, whereas in Los Angeles, it's about 75% of the population is unsheltered. So that's a huge difference. One very intriguing possibility comes from this book by Sybil Fox called 3 Worlds of Relief. She did a study based on data that was collected at the county level throughout the United States, right at the beginning of the Great Depression by the federal government. And it looked at local programs that provided public and private relief. That could be cash relief. It could be almshouses, poor houses, or what today we might consider shelters. So it looked at a range of these kinds of programs, private and public cash, as well as these sort of indoor relief measures. And what she concluded is there's really 3 different social welfare systems in the United States at that time. The first, let's consider, is in the Northeast and Midwest. In this region of the US, you have a lot of industrialization-related wealth from the Industrial Revolution. That generates a whole movement of philanthropic interests, private groups who are trying to help and assist with anti-poverty measures, in some cases, housing quality concerns, as well as immigration integration. And largely, this was sort of white European heritage Christians seeing themselves as helping other white European, in many cases, Christian immigrants. And by the way, politically at this time, of course, we have a nascent union movement, which in large measure is driven in part by recent immigrants who have coalesced around labor organizing. And this leads to a broad level of social support for public and private relief. Now, this is contrasted with, say, the South, where we have an agricultural economy based on a sharecropping system that essentially indentured and exploited Black people's work for low wages in the seasonal economy. And of course, there's the Jim Crow system, the separation of the races that led to vastly different social experiences and life experiences. And there was very little support to provide public cash relief of any kind, because it would only reduce the incentives for the Black people to be working for such low wages in that economy. Similarly, in the Southwest and the West, also a dominant agricultural economy, dependent on migrant labor, mostly coming from Mexico. And so there was no interest in providing any public assistance because they wanted to induce these migrants to return to Mexico after the harvesting season. So in essence, Sybil Fox argues these led to three different social welfare systems in the United States. So if we fast forward from 1930 to 1980, when we have the homelessness crisis emerging in the United States, what's the situation? Well, I actually was in a room in Philadelphia in 1985 where we could call 6 different leaders of homeless programs to come to a gathering, and we could commit over the next 6 months that we would double the number of shelter beds we had. In fact, at one point, we got to 4-fold the number of beds we had in 1985. By 1990, we had almost 6,000 beds. So there was a capacity there to grow and expand that system. It had access to private philanthropy. It had access to government-funded programs, et cetera. So it was a whole different environment, whereas you could imagine in some of these other places, they might have a gospel mission, they might have a Salvation Army, or 1 or 2 small programs, but they didn't have the kind of capacity. Now, that itself is obviously a historical legacy concern, but then when the federal government starts to fund homeless programs with the McKinney Act in 1987, for the first 8 or 9 years of that funding, it was done as a competition at a program level. So literally 3,000 programs would apply for funding from the federal government. And of course, first of all, the winners were people who applied and the people who had been around and could write good applications. So it rewarded this historic legacy and inequality between these regions. And it just exacerbated the gap between the places that had high degrees of shelter versus places that had low degrees. And we didn't go to a formula system until 1995. And even then, there had to be special accommodations because places like Boston and New York, Philadelphia, Chicago were getting more money than their fair share, even when a formula was instituted. So they sort of had to be grandfathered in to keep that money because they didn't want to have to cut them. So this is a complex thing, but it's an alternative explanation to simply, oh, it's the weather. And that's why people as though people in California don't care about providing shelter to people who are homeless, or that it's easier to be homeless in Seattle. I don't know many people that moved to Seattle to be homeless because of the weather. We are doing some research. We've modeled statistically based on Dr. Fox's data. I've been working with Tom Byrne, and the analysis we have shows that almost half of the quote unquote weather-related differences in unsheltered can be explained by these 1929 variables. 2009 was really important in the US for a variety of reasons, but 3 major policy changes occurred. The first was through the American Recovery and Reinvestment Act. This was the policy, the act that was intended to jumpstart the economy after the Great Recession, looking for shovel-ready projects where they could get money onto the streets quickly. And so the Homelessness Prevention and Rapid Rehousing Demonstration Program was started there. We call it HPRP for its acronym. And it was a total of $1.5 billion over a 3-year period. So about $500 million over in these two periods. And by the way, just to tell you, this is about what the annual, I think it was about 2 billion, a little less than 2 billion annual in homeless spending at the time. So this was a substantial increase, and creating a whole new program that did not exist in the US, a concept that largely did not exist in the US, in which we borrowed a lot from the UK and different work that had been done in the UK on homelessness prevention. And so that was important. We also had the renewal of the Hearth Act. The Hearth Act was the McKinney-Vento is our main homeless program, federal legislation. It had been passed in 1987, and it wasn't until 2009 that it was renewed, and that was under the Hearth Act. And it basically put in law several changes that have been occurring over time. One was making housing first the national policy. The second was it created a permanent rapid rehousing program within the federal spending on homelessness. It also deprioritized transitional housing. Transitional housing had been a growing movement in the US from the early 90s to this point. It was absorbing a lot of resources, and the research was not showing that it was effective. It was certainly not cost effective, and the outcomes were not good. So for a variety of reasons, that there was let's remove the money from transitional housing and let's put it into housing programs that are actually going to solve people's homelessness immediately. Whether that's through rapid rehousing or through permanent supportive housing. Then we had the Obama administration's Homeless Veteran Initiative that was also launched in 2009. That led to a $1.6 billion initiative in annual spending by 2016. 87,000 units of housing for chronically homeless veterans were established in that period. Permanent supportive housing, these are vouchers that are used by the tenants to go rent a unit, so it's not actual buildings. Another 350 million was annually allocated to the VA's own homeless prevention and rapid rehousing program. So altogether, spending went up 300% from 2009 to 2016. So pretty significant spending increase. So as you might expect with all that, it led to a lot of changes in the organization of homeless services. And this graph reflects that. So here we have 2009. You see, that's the point at which all of this stuff starts to separate. And this top line is permanent supportive housing, targeting people who are chronically homeless, including veterans. And you can see that it almost doubles in size between 2009 and 2022. Okay, the blue line is the transitional housing. As you can see, since it's now been deprioritized, you see a steady decline in the number of transitional housing units, but it's offset by this increase in emergency shelter units. A lot of these programs basically relabeled themselves and remissioned themselves to go from transitional housing to emergency shelter. So there really is not a net decline in total beds here. It's essentially equal if you add those together. And this lighter green is the growth in the rapid rehousing. As I mentioned, you see it goes from 37,000 to 150,000. So very significant growth, fivefold growth, because it was brand new basically as of this. And then we do have other permanent housing for people who aren't chronically homeless. A lot of these are for families who are experiencing homelessness, but they're dedicated vouchers and units for people who do not have disabilities and need supports. So this gives you a sense that it's changing pretty significantly.
Dennis,
yeah,
can I ask you to maybe just explain very quickly for the audience what the rapid rehousing is exactly, because I don't think that everybody is aware of what the concept actually means. Sure.
So rapid rehousing is intended for people who are newly homeless or have become homeless in, say, the last 60, 90 days. It's intended to provide a relocation grant, which is first last month's rent and a security deposit to help you get into a unit. It also provides you with some support in finding that unit. And it can then pay your rent anything from 6 months to up to 2 years. The VA's program is now up to a 2-year subsidy. And but in many places, it's more likely to be a year. So it's intended to sort of get you back on your feet until you can get back into the labor market and be able to pay your rent going forward. So it's relatively new, but that's the basic program. And as I say, it really built off of a program in the UK that we modeled it from. All right, so what's the impact? Well, on the left-hand side, upper left-hand side, this is the number of families who experience homelessness at a given time. You can see there's a 35% decline in family homelessness from 2011 down to 2022, okay? Among veterans, we have almost a 60% decline from 2010 down to 2022. So again, and this is where the most resources were invested. So essentially cutting the number of homeless veterans in half. Youth homelessness is measured here, drops by 25%. We didn't have data before 2017. I think a lot of people are skeptical that there was this much of an impact on youth homelessness because most youth homelessness isn't expressed by people in shelters. They're very often couch surfing and in other places where they may not be enumerated. But I think the general trend, in other words, how is it possible that we had flat homelessness from, say, 2014 to 2022, despite these increases on the West Coast? It's because across the country, we were seeing substantial declines in family homelessness and veteran homelessness at the same time, okay? So I want to talk a bit about some of the major challenges that we face in the systems that respond to homelessness. First is that it's clear that emergency shelter is not scaled. We only have one bed for every 2 adults who is homeless in the United States. So only 50% of the adult population is accessing a shelter bed. 90% of the families have access to a shelter bed, but still there's a 10% shortfall there as well. Why is this? Well, there is no statutory obligation for governments to respond to homelessness. There are very few exceptions, like New York City, where there's a lawsuit that led to a consent decree that the cities agreed to provide shelter, but it's still not a statute. In Massachusetts, the annual budget process includes language that families shall be provided shelter on demand. But again, it's just budget language. It's not a statute in the same way. So these are just a few of the exceptions, DC similarly. But the rest of the country, if you're a person who's homeless, the only obligation that society has to you is that if you dial 911, the EMTs will come and possibly take you to an emergency room. But you do not have access to shelter. No community is obligated. Most shelter is provided voluntarily by a fragmented group of charities and relatively weak nonprofit organizations. These are not like big social welfare organizations with highly professional staff, but like you would find, let's say, in child welfare or in other such programs. We estimate about $10 billion a year is spent on emergency shelter. So to cover the gap would probably cost another $10 billion. That would put us up at about $20 billion annually. And I think that's highly skeptical that that would occur. Our homeless housing assistance programs, which are permanent supportive housing, we use the acronym PSH, and rapid rehousing, those programs are not scaled. They're only reaching 10 to 20% of the people who are eligible. So if you're a chronically homeless person, the odds of you getting into a permanent supportive housing unit are somewhere between 10 and 15%. And it's similar for if you're a short-term homeless, if you've just become homeless, your ability to get into a rapid rehousing program is around 10 or 15% as well. Meanwhile, I just want to point out that Beth Shin and Jill Kaduri in their book in 2020 said it would cost about $30 billion to close the rental affordability gap for all low-income renters. So we're not just talking about serving 600,000 people on a night, but millions of people across the whole year. And that would be only 10 billion more than providing shelter to everyone. So I think this provides caution to those who think that we should build shelter out to capacity, when in fact, going just a little bit further than that, we could actually provide a housing voucher for everyone who is eligible. The West Coast homelessness problem has major systemic weaknesses in our social welfare system that I just also want to mention. As I said, first, homeless assistance and emergency shelter are not likely to be scalable anytime soon. The sources of revenue that fund these programs, okay, and about 40% of it is donations, but the 60% that's public funds, those programs, that spending increases incrementally year by year in relatively small amounts. If lucky, keeping up with inflation. If super lucky, they're better than inflation. But in other words, trying to grow that revenue stream to cover these homeless assistance programs and bring them up to 80% even is not really feasible. It leads me to also conclude that we really need to focus on safety net repair, because ultimately the reason we have this homelessness problem is that our safety net isn't working. In particular, I'm pointing out the situation for older adults, which I would say is people over 55 for sure, but it's certainly some people who are homeless over 50, and also people with disabilities. We do have a safety net that's designed for this population. We have an income program, a guaranteed income program called SSI, Supplemental Security Income. It's the program for people who don't qualify for our Social Security benefit system. They didn't work in jobs that contributed to that Social Security system, and therefore they are not eligible. So they get into this program, which is much more limited in terms of the cash support. But that's the income. And the other part is Medicaid. And that's the health insurance program for this population. So I'll talk about that in a minute. But keep in mind that both of these programs, SSI and Medicaid, were designed to prevent destitution among older adults and people with disabilities. Okay. So that was their intent from the beginning. And they've been around since 1965 in one case, 1972 in the other. But because these are entitlements, right? If you qualify, the government must deliver them. They're theoretically scalable. They can reach everyone, and sustainable because it's funded directly by the federal government. They're not discretionary. And most of the tab is picked up by the federal government, 80, 90%. So it seems to me the place we should be focused. So I want to mention about this SSI program. It is for seniors and people with disabilities, but there's very low enrollment among homeless adults. It is not easy to get into this program. If you reach 65, which is the official age for eligibility for old age, then of course you can get in. But everybody under 65 has to come in under the disability criteria, and it's very complex and difficult to get through that process. Even for people who get through successfully, it usually takes 12 to 18 months. But even when you get the cash, it's 45% below the poverty level. In the US, it's $850 a month. I'll say a little bit more about that in a minute. And Medicaid, which is the health insurance program, is not reaching this population, except through emergency rooms and hospitalization. So people are not getting basic care. They're not getting primary care, preventive care. They're not consistently seen and served, whether that's in mental health and substance abuse programs or people who have physical health needs. So people are pretty sick by the time they're showing up into these healthcare systems. And it's created quite a problem for our local hospitals, who are dealing with large proportions of their emergency room population coming in, who's, in many respects, their main issue is that they don't have housing. Just to show you how this tracks with the SSI income, what you see here is the blue and the red combined. This is for California. This is the SSI level running back all the way to 1975. And that's the combined amount. And then the top line here is the fair market rent for a one-bedroom apartment, and below that is for an efficiency apartment. And you can see that basically your head is above water, barely, for most of these periods of time where the rents are just below. And if you're paying rent, you're paying almost 100% of your income on rent. And then suddenly the rents are exceeding the income. And then starting in 2014, this slope of this line and the slope of this line are very similar to the growth rates we see in unsheltered homelessness and chronic homelessness since 2014. So clearly 2014 was a pivotal sort of turning point where the rent started to exceed people's income pretty substantially, and it became evidenced by the growing unsheltered homeless problem. So, all right, what might we think about major reforms needed? Few things I would suggest. For example, accelerating access to this SSI program. It should not take 2 years. If you are destitute, you are on the street with zero income. I mean, literally, you are eating garbage, you're begging, you're having to find sustainable supports in any way possible. These people clearly need some kind of cash. And it would not be difficult to do a screen to assess whether they're likely disabled or have some criteria threshold. We might even argue that we need an emergency SSI program for people who are destitute. There should be no people who are destitute in the United States that literally have no cash. There's no reason for that, except that our programs are not designed to address it. Even if they did get that income, as we see that the rental it's not enough to cover the cost of rent. So there has to be some supplemental rental assistance to close that affordability gap, including enabling people to live in shared living situations, because we don't have enough efficiency in one-bedroom apartments that are affordable at the fair market rent. So even if we had a rent supplement of, say, $600 to $800 a month combined with the SSI, it would not be enough for many people to get into a unit. So we have to think about shared living. There's recent surveys that suggest as many as half of the people who are adults and are homeless and unsheltered would be willing to go into shared living arrangements with family members, friends, roommates, or even boarding situations that could be created for this purpose, and people who could open renting rooms for this purpose. So we need to be thinking about something more flexible and scalable. As I mentioned about Medicaid, we have a problem in the sense that we had this massive expansion in Medicaid, which was good. Some people call it Obamacare, but the Affordable Care Act essentially took a program that was designed for elderly and disabled people and expanded it to include all people who are under 250% or so of the poverty level, greatly expanding the number of people served. And what governments did was they then contracted with private insurance companies to manage this benefit. And they get paid a per member per month fee. And then, of course, they're for-profit companies. So their incentive is to serve as few people as possible and with as few services as possible. And so expanding the number of services, they want to enroll as many people because that's how they get paid, but actually serving them, is counter. Potentially, I'm being a bit cynical here, but it's the way the profit motive works. Let's be clear. And what's most difficult is there's really no incentive for them to serve very difficult populations who consume a lot of time and energy, unless they recognize that it's actually, from a cost basis perspective, they actually could save substantial resources by providing more preventive care. In any event, it's a mess. And to fix this is going to require a lot of attention, and at the federal level, but of course at every state, to figure out how they can get this benefit, which again was designed to prevent destitution and the lack of insurance among poor and disabled, elderly and disabled people, and children in single parent households. How are we going to get them housing navigation? How are we going to get them enrolled in their benefits and making treatment services available? We hear lots of hue and cry about people with substance abuse issues, people with mental illness and sickness on the street. And yet, are people aware that there are no treatment services for most of these people? That there aren't beds available to them? Everyone's talking about involuntary commitment of this sort or the other. There are people who volunteer to try to get treatment, want to be in these programs, and there are no slots. So we have a huge problem here in perception and in reality. And another point I would just make is similar, of course, beyond these, I've been focusing on the adult population, but we also have families and we have young people who would also, of course, benefit from rental assistance as well. They're less likely to have the same kind of social and medical complications, but certainly these groups, much smaller in general than the overall population, would benefit. I just want to lastly mention, we hear a lot about universal basic income. There's tremendous enthusiasm from universal basic income out there. They want to, in giving it to all sorts of different groups. I certainly support what the research is showing, that these are having very positive benefits, but I also want to plead with advocates for UBI. You know, we do have a UBI program for people who are elderly and disabled. It's called SSI. And why are we not hearing the same level of advocacy for expanding a program that's already on the books and should be made to work, and in particular would be beneficial for this population? All right, lastly, I'm just going to mention the latest that's happened. So the first slide I showed you with this graph ran from 2007 to 2020. We, during COVID, lost a data capture year. But what you've seen from 2022 is still pretty flat. Right? But then suddenly we have this 13% increase between 2022 and 2023. We've never seen increases, double-digit rates of increase. As I've said, most of these are 1% to 2% changes year to year. So clearly something more is happening than just the usual growth or decline in homelessness that might be expected. And what this does is it really does reflect, I think most significantly, the migrant crisis. If you tally up the growth in homelessness in just the 4 states, Illinois, Massachusetts, Colorado, and New York, which have been the primary destination, the governor of Texas, Governor Abbott, has been sending busloads of migrants to these states, but principally to the cities of Denver, Chicago, New York, and also the state of Massachusetts, which has that right to shelter for families. And if you look at those increases in those states and those cities, you see you got 75% of the total increase in homelessness would be accounted for in those 4 states, 56% in just those cities, okay? And that's not just those cities. And then we see also a 48% increase in Hispanic homelessness. I mean, that's an alarming increase, 48%. You would never see that. All of those things indicate to me that the migrant crisis is around 70 to 75% of the growth is attributed to the migrant crisis, which is not normally, we don't usually count that as homeless in the US. There's a different system for accommodating asylum seekers and refugees and migrants that is separate from homeless assistance. So that has certainly complicated the number picture, but so that's that. But it also as well, if you look at the total increase, the growth in chronic homelessness accounts for 20% of that growth, okay, which is really concerning. We had so much progress with chronic homelessness and then not only stopped, it reversed. So obviously it means there's longer stays, reduced rates of exit, basically the same thing. It likely reflects the limitations of our housing exit programs that are being overwhelmed by more and more people who can't get through these exit programs, as well as we have increasingly unforgiving housing markets that people could blend into, somehow get into through other routes. So I think that both of those things are likely contributing to increasing length of stay, which, by the way, is happening across the country now. It is not just to the West Coast. It was there, but now. But in particular, I'll just note that, for example, in California, if you look at the growth in homelessness from 2022 to 2023, 95% of it was due to a growth in chronic homelessness, not to new people, in new entrants. But I do want to point out that new entrants are, of course, a part of the population that is contributing to growth, but it's likely only 5 to 10% of that overall increase, and of course reflects the continued exacerbation of the housing affordability crisis. And I think that's it. We can go to Q&A from there. Sorry for the technical malfunction, but live TV.
Absolutely. Thank you very much, Dennis. I hope there is a bit of technical issues on both sides. Apparently, the sound here in the FEANTSA office is not great. I'm now using headphones. I hope it's a little bit better now. But we heard you loud and clear, Dennis, so no worry. Thanks a lot for the information. Very dense, but extremely interesting. I have prepared a few questions, but there is some questions already on the chats that we might just throw at you because they're more technical question. One question is, can you explain the background to having the veterans as a specific category in the of the homeless population in the US context? Because you talk a lot about the veterans and especially the success with finding housing solutions for veterans. Like, what's the background to that?
Well, I think that, first of all, people who are unsheltered and who are visibly panhandling and begging, you very often will see people say that they're a veteran and they want to, they're begging for support and using the fact that they served their country as a way to, urge people to donate to them. And so the general public has this sense of like, why are there veterans who are begging on the street? Now, when you look at the homelessness rate among veterans versus non-veterans, it's actually not any higher. And the studies that have compared homeless veterans and non-veterans, they don't look any different in terms of the single adult, mostly male population. It just so happens that the people who experience homelessness, they're coming from a portion of that population are people who are veterans. So it's not as though the veteranness has uniquely contributed to their risk, although I can't say that entirely. There are a certain portion of veterans for whom they have had disabilities and things related to military service that have increased their risk, but it's not the largest part of the population. By and large, the population looks very similar to the non-veteran population. That said, there's a lot of political will to support veterans, that people who serve their country should not be destitute. They should not be on the street and with no place to survive. So there became a lot of interest in this, including in the Bush administration. During the Chronic Homeless Initiative, there was specific priority given to veterans. And then when President Obama was running for office, he made a claim publicly that he wanted to make sure that no veterans were homeless. And so when he was elected, that became one of the priorities of the Department of Veterans Affairs. And there was a joint program with the Federal Housing Department, HUD, to focus on doing permanent housing for that group, as well as connecting them to healthcare, et cetera. So it became a huge initiative. And the proportion of homeless who are veterans dropped substantially, almost dropping 50% in that period of time. So much smaller. I think we're now down to about 7% of the homeless population are veterans, which is much reduced. But it provides kind of a natural experiment of what happens when the federal government decides that it wants to address a problem and it puts the resources there. Wow, you can have huge, substantial impact and success. And there's really no reason the other people, if they may not have served in the military, but they're just as American as everybody else, and deserve support and resources.
Yes. There's a second question, which is more, it's probably a more difficult question to answer, but I'll try to rephrase it. But is there, do you see any difference if you look back 20 years between what Republican governments and what Democratic governments have done relation to homelessness, and what do you expect after the elections, the main elections?
Well, it's hard to say about what will happen, but I can say that homelessness has been a bipartisan issue from the Congress standpoint. And it's the Congress that really sets policy and budget. And I think that it's to the credit of the advocates, it's to the credit of the leadership on both sides of the aisle that homelessness was not politicized. And since the McKinney Act, there have been consistent increases. Even when there have been years when budgets were frozen, the homeless budget would still get increases. So, I think that there has been investment. And by the way, over time, through the budget process, the housing first kind of programs and priorities developed into what became the federal policy. So, and that started with the Bush administration, which the Chronic Homeless Initiative started during the Bush administration, did about 50 to 60,000 units of housing, vouchers for people who are chronically homeless. And then that got picked up, the Obama administration, with the Veteran Initiative. So again, it has been bipartisan. I think we saw the first change in that during the Trump administration, when they attacked Housing First. They had allies as well who were criticizing Housing First, arguing that the growth in homelessness was apparently evidence that Housing First was not working. And so they used that, as well as sort of politicizing the Democratic mayors in a lot of these cities as being reckless and not doing enough to address homelessness. So that narrative arose as part of that.
Yes, yes. I think we can say at the European level that it's also a bipartisan issue, but that doesn't stop certain politicians from trying to politicize the issue. There's another question that I had myself. You said in your introduction that there was an attack on Housing First, but you didn't elaborate on that during your presentation. And somebody asked, would you say like what was the content of these attacks? What arguments were being used, and did they have any effect?
So I think that it's mainly come from folks who've sort of seen if you've been to San Francisco, let's say, and I don't want to just single out San Francisco, but it's a relatively small, large city. And the homeless population is very visible. They're concentrated in certain areas. There's open air drug use. There's clearly chaos and disarray, and people just think that is the evidence that Housing First is failing. They don't look at the fact that, well, Housing First is really aspirational. We say we have Housing First as a national policy, but it's really an aspirational policy. As I mentioned in the presentation, only 10 to 15% of people are getting housing assistance first. And they're not even getting it first. It's still mostly shelter first, street outreach first. We do not have Housing First. But we know that when people do get housing, and we don't require that they go through treatment to get into that housing, the rates of success are extremely high, running 85, 90%, retention 1 year after in the program. So we have lots of empirical evidence to show Housing First works, but it's clear the real problem is scale. It's not the programs aren't working.
Another question I had then is, like, you refer to 2009 as like a crucial year where massive additional money was made available. Can you explain a little bit what context allowed for that kind of decision? Like, why was it then? And like, because we had similar big recovery programs in the European Union, but homelessness didn't feature in these programs. What made it possible in the US, you think?
Well, the two things. One was that, well, it's three things I showed. That one is the Recovery Act money was money that had to be spent. It had to be spent immediately within the 3 years it was hit on the streets. So, and we had never had a rapid rehousing program. We only had chronic homeless programs, when most of the people who experience homelessness are not chronically homeless. And yet we had nothing for them other than emergency shelter, if that. So having a whole new program that was designed to provide an alternative to shelter was something that really was mind-changing, I think, within the field of practice. But what made that possible was that the advocacy groups who were consulted by the Congress and administration, and they were figuring out how should we spend our this new money that's coming along once. Should we do more shelters? Should we do more PSH? What should we do? And the advocates argued for this rapid rehousing and prevention program. And so it created an opening for a new emergency legislation. And then, of course, the McKinney Act had to be reauthorized. And that was had been several years in the making. So that was timely with 2009. But also, of course, we have a new president. President Obama comes in 2009. He has his priorities, and his homelessness priority was veterans. So turns out 2009 was kind of a pivotal year for all of these changes to sort of take place.
Yes. Another thing you said in the very first, that one of the hidden narrative, or the narrative that is not getting sufficient attention, is the policy progress that has been made. In Europe, there is more and more a concern that there is quite a bit of time lag between a decision to change the policy for the better and the results, or the materialization of the impact of that policy in the numbers. But when you look at the US data that you showed, it seemed that the impact of the decisions was quite immediate, that the person who is responsible for the new policy would actually take the credit for it as well. Is that still the case?
To the extent that we have policy changes and there's money to do it, I would say it is possible, because it's a year-by-year budget process. When communities, in order to get this federal money, they have to submit an application. And the federal government requires in that application that the communities are developing a plan for how they're going to change to meet these priorities. So it's not to say that all of this happens overnight, but it is possible to pivot relatively quickly, because you have this annual funding process where people can change and move dollars around and put increases of dollars in the right places, in the intended places. And then over time, it accumulates. So I think that it's just evidence of what an annual budget process, which has its own disadvantages, of course. An annual budget, some countries I know have 2- and 3-year budget cycles. But it is an advantage of an annual budget process and the relationship that we have between the federal government, local governments in this particular case.
Yes, because I'm only throwing it at you. I have I don't know, of course, but we read in the news that the HUD secretary resigned recently. And she is apparently considered as a good person who did very good things for homelessness, but still confronted with record high homeless numbers. The two are not related, I guess.
Well, the difference there, okay, basically, progress with veterans essentially started to stall around 2017 because there were no big increases in vouchers. There was an 8-year period where vouchers went up 10,000 slots a year. That ended around 2017. So the Congress hasn't created lots of new vouchers, not only for veterans, but for non-veterans. So localities can only do so much, and Secretary Fudge and HUD can only do so much. They're stuck with the resources they have. And without any substantial investment in new vouchers, that's really what allows you to drop down your chronic homeless number. I mean, because it's almost like it's not quite a 1-for-1, but it's close to like 0.6, 0.7 reduction for each voucher. So, you really have to we have to keep building and expanding that supply. That's for sure. And then increasing in housing prices in the rental market has meant that even, let's say, the Veterans Rapid Rehousing Program, $350 million, it's serving fewer and fewer people every year since 2017 because it's paying rent and the rents are going up, but their budget amount is staying the same. So if you have the same budget amount, rents are going up, it means you're going to serve fewer people. And that's what's happening. So we've had a slowdown in progress as a result of those things.
Yes, the questions are coming in now. Dennis, I'll keep you busy for a little longer. Somebody is asking about the attitudes. I don't know if it's true, but there is the assumption that attitudes towards homelessness, public attitudes, become harsher. First of all, is that true? And does that have an impact on policies that are in place?
Absolutely. I think that the growing visibility of homelessness has had a huge impact on public sentiment. There is hardly a community or public resource that is not impacted and where the general public feels an impact, whether you're talking about the streets, which are obvious, or parks where they would be going with their families, or whether it's the public libraries, whether it's areas around schools. It's the demand on the police departments. It's the demand on sanitation workers. It's the demand on EMTs. There are some EMTs in some cities who are solely dedicated to responding to homelessness at this point. It's the impact in emergency rooms. So the problem has become pervasive from the sense of the public. And so they're, and they hear their politicians saying that they're doing everything they can, that they're doing amazing things, they're doing great things. Even in some cases, there's incremental progress, to be sure. But the public is frustrated. And if partly they can't blame the politicians who claim that they're doing everything, well, who are they going to blame? They're going to say, well, it's these people. And it has led to a justification of anti-homeless sentiment. And you actually have public figures who are stating publicly things that are actually quite offensive about people who experience homelessness. And this is kind of legitimized random acts of violence, which are increasing. And these people who are homeless are often, more often than anyone else, the victims of violence and police mistreatment and brutality. Not just police, but we also have lots of private security companies that are protecting, apartments and commercial buildings, etc., who also can be abusive towards people who are homeless. So it's created a really poisonous environment with regard to trying to cultivate a compassionate, sensible policy when you're having to push against this rhetoric, which, by the way, it seems to be coming from both sides of the political spectrum here. It's deeply frustrating and harmful.
There is some questions in relation to prevention. You mentioned in terms of the solutions quite a bit on prevention. I think you need a stronger social security system, better targeting people that are at risk of homelessness or currently homeless, etc. But are these things that you feel need to be done, or is there solid evidence that they will make a real difference on homelessness specifically?
Good question. We have not, as I say, as a field, the homelessness field has looked inward, I think, for a long time. And Housing First gave us something to examine, test, validate, etc. We have dedicated homeless resources from our Congress, maybe from our states. So we've focused internally on those resources and have been pleased with ourselves, maybe too much so, by seeing this incremental progress and seeing this declines in homelessness that have been occurring, and especially in some communities, quite substantial declines in some local communities. They really reduced homelessness significantly. So I think it was easy to be patting ourselves on the back. But if you take a step back and you look to see, well, even with the increases we have, we're not going to make the progress we need to serve the millions of people who are coming into homelessness each year. It's just not gonna, our little resource is too small to address that. And similarly, when you see the crisis that has emerged on the West Coast, it makes you wake up and say, wait a minute, this is way bigger than just how are we gonna get everybody, one person? Because yeah, we can solve each person's homelessness. There's no doubt about that. But we can't solve homelessness unless we are substantially increasing the protections, the broader protections that will stop people from coming into homelessness, making sure they have basic, adequate income. I mean, we're talking about older and disabled people who are not able to work. That means they're entirely dependent on what the government will give them. And I don't think many Americans are aware that that basic income is 45% below the poverty level. And that should be a concern to everyone. And that not only that, but that the housing prices, of course, have swamped what can be done with this. I think that's a fundamental social concern here that will go much farther than these homeless programs. But again, it is going to need, as I said, rental assistance, there's healthcare, there's a lot of systems failing here. And so many places that we should say are criminal before we criminalize homelessness. We should criminalize our societal response for being so grossly inadequate and inhumane.
Sorry to ask a complicated question following on from what you said, but the last slide you showed that 75% of the increase in homelessness in the last year is related to migration. I don't know if it was for the US as a whole or for certain states, but it's a massive increase and a massive share of the increase. And we see similar trends in Europe, certainly in some European countries. How do you deal with that, from a also prevention point of view?
But so first I just wanted to say that we knew before the new data came out, all you had to do is read the newspapers in Chicago, New York, and Massachusetts to know, in New York, the number of homeless was going to be up 50%. 50%. And New York accounts for 15% of the total US homeless population. So we knew already there was going to be somewhere around a 6 or 7% increase in the national number just because of what was happening in New York. Okay, so it's not hard to dig back and say, but the fact is that we don't record in our homeless records whether someone's a migrant or not. That's intentional. So it can't be found in the data. We have to back into it as I did. What to do about it? That's a tougher question. And I've participated in some meetings in New York recently, for example, where it's really interesting to see how the homeless service providers have mobilized to try to respond to this crisis. Again, now, New York is unique because literally there is an industry for homelessness in New York City, a well-funded industry, $3 billion a year even before the migrant crisis. And they are able to mobilize their staff and retrain to focus, and mostly they're focused on getting people jobs and getting people back into some kind of work, as opposed to focusing on housing, because the migrants are very much employable and ready to work, and who feel like if they can get a job, they'll be able to find a place to live. Okay, so it's a different set of priorities, and I've seen it at work there. But each community is having to find its own solution. I know in Chicago, it's a different environment. They have to find their own solutions, including regional, on how they're going to find housing for people. It's just not what the homeless system was designed to do. It's not what homelessness researchers have been thinking about, I have to confess. It's new territory.
Yes, well, I don't it's the same. It's new territory in Europe, even if it's the experience of migration is a bit older, but we're still struggling with it as well. Am I right I'm jumping from topic to topic, and we'll come to a close soon. But am I right that the whole cost-benefit argument that we heard a lot coming from the US about 10 years ago has disappeared a little bit in the argumentation for better homeless policy, or is it still there?
It's still there, but I think that it's sort of, had its time in terms of capturing the imagination of legislators, who now seem more captivated by other concerns related to this. But it is a very important component of the argument overall. We are spending, and some communities are spending, a tremendous amount of resources just to manage day-to-day cleaning up after people who are homeless. So at some point, I hope that the cost argument resurfaces in a way that's actionable, because remember, the other problem is who pays for what. And, there are dedicated pots of money for all of these different things: sanitation, EMTs, shelter, so how do you get the resources in the right place? That is the challenge. And that requires our Congress and legislatures to actually think about these bigger, broader based programs, these housing subsidies, which are more costly in the long run, but not more costly than the chaos that results, and the spending from all over the place that is involved. So it's a challenge, but I believe that argument will always be salient. And it's important because there's certain people who care more about that than they might necessarily care about homelessness in general.
Yes. Another thing was the involvement of Medicaid in relation to homelessness. Can you explain a little bit about what that could be? Because you said that there is the cost-benefit argument made there as well, and probably it can be cheaper for certain homeless people to house them stably than to pay for their medical bills. What's happening there, and how you see that evolving in the next years?
So I would say we've seen consistent evidence that people who are very frequently involved in the criminal justice system and the jail system who are chronically homeless, we've seen, especially a recent experiment done in Denver, that you can save money by getting those folks into housing with case management. People with severe mental illness, we know, are very costly healthcare users. When they're hospitalized, they tend to be hospitalized for very long periods of time relative to other patient populations, 2-3 weeks, even months at a time before they're able to be discharged. And then we have this growing elderly homeless population, and elderly people already have increasing healthcare costs associated with age, and not being able to care for themselves after a hospitalization means they go to nursing homes. So I think we have very compelling evidence that there are at least those three populations where you could argue there's cost neutrality, if not better, over the long run, for sure, for these particular groups of people. But a smart policy would say, well, we can't really always identify all of those things and who is going to be those groups over time. We really should provide a broader base of support to everyone to prevent people from becoming these high-cost cases. I mean, that's the way an actuary would think about it. And but we just don't have that thinking here at the moment. But I do believe that there's still an argument certainly to be made. But Medicaid, as I said, is a bit of a mess because we no longer have a fee-for-service system where if you're a provider organization and you decide, we love homeless people, we're going to work with them and focus on them, and we're going to charge and make money for every person we serve, and we're going to get paid. But that's not the way it works anymore. Now these companies get this lump sum of money. They have to approve who gets what. They don't have to provide funding for all of those services. They don't have to serve everybody who's entitled for everything they're entitled to. And so how we wrestle that huge resource, because by the way, it's the #1 social welfare resource that goes to our states from the federal government. So it's the most important anti-poverty program actually in the country when you think about it. But certainly if there's going to be a solution to homelessness, that's going to have to be a huge part of it. And I know there are many smart minds on Medicaid. I may not be one of them, but there are people who can help us think that through and come up with a much better solution than we have right now.
And is it thinkable that Medicaid is used at scale to pay for rent or for housing costs for homeless people?
No, but there are, I think at last look, 6 states that have submitted applications and approval from the federal government to experiment and use their Medicaid dollars to help pay for basically rapid rehousing. First, last month's rent, security deposit, move-in expenses, as well as up to 6 months, and in one case, up to a year in rent, but not sustained rent, okay? That has not yet emerged, although one could argue, certainly for certain people with disabilities, that Medicaid should be paying for rent as part of their survival, that without their rent, they're not going to survive, they can't take care of themselves, and that is healthcare for some of those populations. And we have certain people, for example, people with intellectual disabilities who get their rent paid well into their, not just as children, but well into their adult years, but not for people with severe mental illness. If you have schizophrenia, for some reason, we don't consider that as equally deserving of having your rent paid. And I know this is different, that there are countries in Europe where, people with severe mental illness get guaranteed rent, but not in the United States. So there's a lot of underlying, perspective taking, discrimination, prejudice that I think is in there.
Last question, because we're running out of time. At EU level, the 27 member states have, I think it's now about 2 years ago, committed to make substantial progress towards ending homelessness by 2030. So they didn't agree to end homelessness by 2030, but they want to make substantial progress towards it by 2030. Is there anything that you can, like from the experience in the US, etc., that you can tell us to do or not to do, or how can we be practical about that? Because if we're not practical about it, I think the commitment will stay there on paper, but it will not materialize in any trade dynamic. But so any learnings, bad or negative or positive from the US would be extremely welcome.
Well, I think it's relatively pain-free for communities to create plans. The pain comes with actually implementing the plans and committing the resources. So I think to the extent that you can actually come up with multi-year budget commitments that say, if substantial means X, like we're going to increase spending by 50%. Well, obviously that can't usually happen in a 1-year period, the way budgets work, but you could have a trend line showing how we're going to get there. In the 2 cases in the US, the Chronic Homeless Initiative and the Veteran Initiative that produced the biggest gains around chronic homelessness. In the one case, it was a 5-year incremental plan, a $100 million increase each year for 5 years, so that after 5 years, there was $500 million in there. And in the case of the veterans, it was 10,000 housing vouchers every year for 8 years, so that after 8 years, there were 80,000. So it's sort of having a commitment to a trajectory of growth. I think in our case, those have been the things that have worked and produced the most. So I would suggest that. But I would also say it's interesting that that language sounds very similar to me about the right to housing, because people in the US say, oh, look at all these countries in Europe, they have a right to housing, and we should have a right to housing in the US, as though that's going to solve it. But as I understand the way it's been interpreted in the EU is that it means that you have to show progress every year. It doesn't mean you actually have to give a right to housing to everyone. You just have to show that you're making progress toward that goal. It seems to me very similar.
Indeed. Yeah, that's an interesting thought. Dennis, I think we'll have to end here. We're 1 hour and 15 minutes talking already. It was great listening to you. We have borrowed ideas from the US in the past. We'll continue borrowing ideas in the future, but we'll also watch out for the trends, because what we experience is that some of the trends in the nature and the scope of homelessness happen earlier in the US. So it helps us to anticipate potential problems or opportunities in Europe. And your presentation today helped us in that regard. So thanks a lot for your time. And next time we'll invite you in person here in the office so that we don't have the technical issues. So, but
no problem.
Thanks a million for being here with us.
Great. All right. Thank you.
Bye-bye. Have a nice day.